Dr. Nichelle Goulet, specialize in prenatal, postpartum, and pediatric chiropractic care, along with prenatal and postpartum fitness and rehab. We're going to review what you can be doing for your cesarean scar care prior to the 6 weeks. I have another video for post 6 weeks of what you can do to break up those scar adhesions and why. But for right now, we want to be building in the first few weeks post cesarean a better body awareness through increasing circulation to the belly and to the scar, increasing the nervous system response and awareness, and rebuilding that mind-body connection. So it's very easy when we've had surgery or a traumatic event to not feel connected to a region of our body. So we do want to build that connection again. There's a lot of trauma tied with cesareans, and there's a lot of emotion in those scars. So whenever you're doing this work, it is normal and natural for there to be emotions. And sometimes it means that you do need to work with another provider, whether it's a therapist to heal from the birth, or even a physical therapist or a chiropractor like myself who can do the work with you, and so you don't feel alone with it. I would also like you to consider calling your cesarean or C-section a belly birth. I find it a really beautiful way to call this type of birth as opposed to kind of shortening it to C-section. Belly birth to me is a really beautiful form. So in the beginning weeks, there's not a ton we need to do, but just bringing circulation, connecting the nervous system to the region of the body, and rebuilding that mind-body connection. And then I'll show you some extra tidbits of some really minor muscle activations you can begin doing. All right, let's get started. So this is something you can do during any point in the process, but this is more directed towards those beginning weeks post-cesarean. So the Sharpie mark here is indicating the scar. Again, I put it a little bit higher up just for video's sake. And what I want you to start with is lightly putting your hands over the scar, at least near it, and taking some deep breaths. Rib cage breaths, so you're breathing This is a time for you to connect your mind to your physical body, really bringing acceptance to this region. There's commonly a lot of trauma and a lot of emotions to hear, so if you can't place directly over or it's too tender, somewhere near is really important. And I do suggest more of a skin to skin so that you can really connect. The next thing I have you do after about 10 breaths is just a very light rub over your belly. You can do this without any oils. You can do it with some warm oils. There's Ayurvedic Massage, which I really do like for women early on, especially post-cesarean. Right now, we're just bringing warmth to the belly, sensation to the belly. And then if you're feeling comfortable, you can do a light massage, light circles around the belly in different locations. If it's painful, no need to go into this yet. This is more designed not for getting into the tissues and working muscles out. It's just designed to be bringing more of a nervous system connection and some circulation to this region, giving some love to this area of your body that's done so much. Something you can do a couple days in if you feel comfortable is to begin to activate your core. Now, we'll focus on the transverse, which is the deep abdominal wall layer. But keep in mind, we're just trying to turn it on just a little bit. It's not meant to be a really deep, heavy activation, just enough to begin telling your muscles like, hey, you still exist, remember? So one of them is going to be that transverse activation. Think of your hip bones here and a wire between the two that you're bringing together. So if you look up my abdominal wall here, you can kind of see me doing it. So I'm going to activate here and release, here and release. And you can place your hands right inside your hip bones and see if you can feel that muscle engaging. And in the beginning, I don't expect to do like a full activation, just a little bit of like a, oh hey, I'm here. So that's the activation of the transverse abdominis. And you don't have to do that, but this is something that you can do to start beginning that core activation and waking up those muscles after the trauma of surgery. The other one you can do is a pelvic floor activation and begin waking those muscles up as well and saying, hey, you exist. What you can think about is activating the vaginal canal, activating anus, and pulling up to a center point like a claw game. Another cue is thinking about the vagina as drinking through a straw and pulling up, up, up through. And again, this is a very gentle, soft activation. This is not 100% hardest as you can go. It's more of a 30 to 40, maybe 50% activation. All we're doing is telling the muscles, hey, I would like you to turn on just a little bit. So right now I'm doing that. As you activate your pelvic floor, if you activate it 10 to 15%, you commonly can see the transverse engage without the obliques turning on. So just to review, starting off with just some gentle mind-body connection with some deep breaths by placing hands over or near the scar. Some general rub, light touch to the belly to bring circulation and sensation. If you'd like, you can do a little bit of light massage to your belly when the time feels right. And then you can also do a few reps and activations of your transverse and few reps and activations of your pelvic floor. And these are just a few things you can do in those first 6 weeks as the scar is healing, just to bring some blood flow, nervous system connection, and mind-body connection as well.